I want to greet everybody. Welcome to Education Update's third annual New York Citywide Special Education Conference. And it's amazing because the post office says neither rain nor sleet nor snow. I think that we can say people in the field of special education cannot be kept away either. You've all braved the snow and the harsh elements, come from every borough of New York, as well as Westchester, New Jersey, Connecticut, Florida, and Vermont, all in the hopes of improving the lives of people who are different learners. Winston Churchill once said, "You measure the degree of civilization of a society by how it treats its weakest members." The interpretation of that phrase today in 2013 is how we treat different learners who are often smarter than many others. You will hear about research, the latest developments, and concrete applications from experts. Our gratitude to Chancellor Matt Goldstein, he's the Chancellor of CUNY, Jay Hershenson, Senior Vice Chancellor of CUNY, and Hunter President Jennifer Rabb, who have enabled us to continue our work in journalism as well as special education. And a special thank you to Bob Isaacson of CUNY TV, who's made it possible to share this video and our work with everyone. A loving thank you to my students, to my staff, college grads. They're all different learners along with me, and I'm so proud of them. I now want to introduce the Dean of Hunter College School of Education, who, as Winston Churchill, also comes from England. Former Commissioner of Education of New York State, and he'll now share his thoughts with us. Dean David Steiner.
Good morning, everybody. It's great to see you. Polar is she who will not be denied, but when Pola asks, you simply say when, not even yes. But Pola is an extraordinary treasure and gift to the city of New York and to the state of New York. It's a particular pleasure to join Regent Cia and so many distinguished scholars here at Hunter, where, as many of you know, the study of special needs education has been central to our mission for many years. Shirley Cohen is a nationally renowned figure in autism, has been followed by many successors and is still here with us, haunting the halls and making sure that we behave ourselves and continue to study. She was followed by Kate Garnett, David Connor, John Brown, many others who contribute to the study of autism and to other very, very pressing needs of the field. What is striking for somebody who comes from abroad when you look at American education is the criticism that we level, often rightly, at ourselves for so many challenges, the learning gaps, the absolute performance challenges in K-12 education. What we sometimes forget is that the work in special education, while never complete, is really the envy of the world. This country has spent more, and more importantly, more mental resources, more political resources on special needs students than any other country in the world. And that is a remarkable achievement. We continue to lead the world in this critical domain. And it is scholars like those with us today, it is those who work in the schools, who have brought inclusive education, who have brought the level of support for parents and students to where it is today, to whom we all owe a profound debt of gratitude. Yes, we have miles to travel, but we should not forget what has been achieved, because if you go around the world, it is this country that is looked to as really holding the banner for students with special needs. I think it's fair to say that so many of us owe a debt of gratitude. If I may be permitted just one moment of personal reflection, I grew up with dyslexia, and when you're Commissioner of Education, you tend to use the word assess rather a lot. Unfortunately, in one of my early emails to the Chancellor, I confused it with a particular rear end part of the human anatomy. And unfortunately, that was not the only time that particular event has occurred. As those of you who study dyslexia will know, part of the problem is you don't learn from your mistakes. I keep trying. So I will be a particularly interested participant with that part of the program. When I grew up in England, you were just a terribly bad speller, and no one knew better. So again, thank you to all the scholars, thank you to Paula, thank you to all of those here in this room, because each of you in your own way have contributed to that great mission that Paula mentioned, the helping of those who need a little bit of assistance. And again, to be here at Hunter College, which has been devoted to this subject for so many years, makes this a particularly appropriate location for us this morning. Thank you so much.
Thank you for those kind words, David, and the wonderful work that Hunter College is doing as well. We're very privileged to have today several brilliant speakers. They come from different disciplines, and the first ones are going to be Doctors Sally and Bennett Shaywitz from Yale, and they'll be speaking about dyslexia. Incidentally, Dr. Sally Shaywitz, they've both written many volumes, but there's a current book out by Dr. Sally Shaywitz. If you have it with you, she'll be happy to sign it later on today. So I'll begin with Dr. Sally Shaywitz and Dr. Bennett Shaywitz.
It's morning, so it's good morning. And I want to thank Dr. Paula Rosen for inviting Bennett and me to share this program, and Dr. David Steiner for hosting it. And as I just told him, I've heard so many good things about him, and then when he said he was dyslexic, I knew why. So you have a sense of the tenor of my talk. We are really excited and privileged to be talking about dyslexia, and we've chosen as our title, The Science of Reading and Dyslexia, Translating Research to Practice. It's time. So I'm going to start off. I could tell you a lot of things, but I'm going to let a very nice little girl from New York, Sky, tell you a little bit about what it feels like to be dyslexic. Now we'll hope it works.
Oh, this picture was me in first grade at Riverdale. Yeah, this picture was taken at school. And there are the kids reading over there, but I couldn't read yet, so I would just sit at my table and draw.
Whoops. And then her mother telling you a little bit about her.
I felt so badly for Sky, and I remember thinking, like, where does she belong? And how traumatic to start off school thinking that she can't succeed in first grade.
And her school that she was in asked her to leave because she was dyslexic. I'm happy to report she's doing very well. I'm not sure I am, but she is. Let's see. Okay. So what I want to tell you about dyslexia is, first, it's really common. Considering how common it is, it's kind of outrageous how infrequently it's identified and diagnosed. It's often not only undiagnosed, but misdiagnosed, and even when it's diagnosed, not adequately treated. And this inadequacy leads to not only school failure, but perceptions of oneself as a failure, and sometimes to life failure. So as a dyslexic would do, I'm going to give you the main idea first, and then we'll give you the supporting details. One is dyslexia, it's really real. And it must be identified and particularly named. It's not a learning difference. It's not some other vague term. It's a very specific entity that has a name, and we have to use that name because that way the children and adults who are affected get the appropriate treatment or accommodations. Think of it. It frees a child to know that its difficulty has a name. Oh, this is what I have, that it's understood, and it can be helped. It feels good to learn to read and to succeed. And what I worry about most, because I see lots of children and adults who either write to me or call or one way or another interact with Bennett and myself, that it's so critical for children and their parents and their teachers to be let in on the secret. Those children who struggle to retrieve words often and who can't spell and read slowly, they're smart and they can think. And last weekend I was watching all the little Sunday morning news shows, and I was excited to see Condoleezza Rice say, education is the civil rights issue of today, and there are many components of that, but I would hold that dyslexia is one of those components. It's always important to start with the definition. Since it was first described in 1896 by Dr. Morgan and subsequently by many others, dyslexia has been conceptualized as an unexpected difficulty in reading. That is unexpected in relation to that individual's intelligence, they're motivated, their educational level, and as they get older, their professional status. And this is a very exciting graph for me to be able to show you because it provides the empiric validation of dyslexia as an unexpected difficulty. These are data, these were published in the journal Psychological Science in 2010, taken from our Connecticut longitudinal study. That's a random sample of Connecticut school children who have been followed for many years. On the left, these are IQ scores over time, and this is reading scores over time. And the jargon is they're dynamically linked. So what I like to call them is kissing cousins. IQ and reading and typical readers not only travel together, but they affect one another. So your IQ in one year will affect your reading in the next. Your reading in one year will affect your IQ. And that really is very consistent with what most of the public thinks about reading. If you're very smart, you're going to be a really good reader. If you're a really good reader, you're probably going to be really smart. What we were able to do is not only look at typical readers, but look at dyslexic readers. And guess what? There we found something totally different. We found in dyslexic readers, you can have a very high IQ. Not only are IQ and reading not linked, they're not even talking to one another. So you can have a much, much lower reading score. So your difficulty in reading is unexpected in relation to your intelligence. It's very common, 1 out of 5. That's 10 million children in this country alone. More often than you might imagine, Bennett and I visit classes, and you can imagine one of my first questions, do you have any dyslexic children in your class? And not unusually, the teacher will say, oh no, God forbid, you know. And then I think to myself, yes, you do, you just haven't identified them. So every class has children who are struggling readers. Both boys and girls are affected, a few more boys, but not statistically significantly so. And it doesn't go away, it's persistent. It's not a developmental lag, it's lifelong. So it really brings up, and this is the key question, if you're intelligent, if you're motivated, why can't you read? And how do those of us who do read well, how do we know that the lines and circles that you see on this slide make up letters, and the letters make up words, and the words have meaning? So the question is, why does print have meaning? I think we can begin to answer that. First, let's consider what we know about spoken language. We know that spoken language has been around hundreds and hundreds and hundreds of thousands of years. We know that virtually every society on Earth has spoken language, and that our brains are naturally hardwired for speaking. So speaking is natural, it's instinctive, and it doesn't have to be taught. So when a newborn baby comes into the world, you don't have to go run out and buy the spoken language curriculum, because I, as a good grandmother, would have done that. And here's my granddaughter at 2, without having been taught the spoken language curriculum.
Land that I love, stand beside her, to guide her through the day with the light from above.
So without a spoken language curriculum. So let's turn now to what we know about written language. Written language has been around thousands of years, 5,000, 6,000, but certainly not hundreds of thousands. So it's relatively new. There's still many societies on Earth that don't have a print language. I recently saw one of our Yale medical students who comes from Africa, and he told me that his mother's native language had no written counterpart. So still today in the 21st century, and our brains are not naturally hardwired for print. So then the question is, how did the print, how do the letters and take on meaning? So what we know is that speaking is natural, as I've said, and instinctive. Reading is artificial, it's acquired. So what do we have to do so that this unnatural print takes on meaning? It has to be linked to something that has inherent meaning, and that something is spoken language, specifically the sounds, the phonology of spoken language. And I think the linguist Leonard Bloomfield got it exactly right when he said about this relationship of spoken and written language, that writing is a way of recording spoken language by visible marks. So when we think of the language system, whether it's for speaking or reading, we think of this very small abstract unit of speech called the phoneme. It's the smallest unit of speech distinguishing one word from another. In English, there are about 44 phonemes, and I like to think of them as the common building blocks of all spoken and written language. For example, the word cat has 3 phonemes, k, a, and t. And here I've tried to show this as a cartoon. So in speaking, if I want to say the word cat, I have to go into my internal lexicon and access and retrieve the appropriate phonemes, the k, t, and a, line them up, and then say the word. If you're a typical reader, what's the big deal? It's quick, it's automatic, and it comes out. If you're dyslexic, it doesn't work that way. For some reason, we don't know why, these little blocks of spoken language, the phonemes, are not as crisp, as clear as they are for other people. So if a person who's dyslexic wants to say something, they go in, but they can't quite access and retrieve the appropriate sound. So what happens is that instead of saying, for example, a story that I like is a little boy who is dyslexic. He was crossing a very busy intersection with his father, and he saw all the people jaywalking, so he looked up at his father, and he said, "You know, Daddy, those Presbyterians should be more careful." And of course, he knew what I meant. He meant pedestrians. But this happens to dyslexic people all the time. And in a few minutes, I'll tell you what's so exciting is we have some sense of the mechanism of the why. And similarly, in reading, as you'll see below, in order to read, we have to be able to pull apart the spoken word that represents the printed word, so then we can link each letter to its sound and blend the sounds together and say the word. And then, very early on, first grade or so, we say that children master the alphabetic principle. That is, the awareness, the realization that spoken words are not whole globs of sound, but they can be pulled apart into individual segments. And that's important because if they remain glued together, how are you going to attach them to the individual letters? And that's the difficulty for children who are dyslexic. For those who aren't dyslexic, they make this awesome discovery that the printed word has the same number and sequence of sounds as a spoken word, and we say they're ready to read. And the alphabetic principle, you're going to hear just in a moment. Bennett's going to talk about some of our brain imaging work, and that the paradigms that we use are based on the alphabetic principle. It guides identification, and it's the basis of effective instruction and intervention strategies. Bennett's going to talk a very little bit about the brain imaging and the results and what their meaning is. Why is that important? And then I'm going to come back and try to say, well, why do we care about all of this? What does it tell us?
Well, thank you. It's a great pleasure to be here. Over the next few minutes, I'd like to give you a sense of what we've learned in the last 2 decades about the neural systems in reading and dyslexia. And we've learned so much because of the emergence of a wonderful technology called functional magnetic resonance imaging, or fMRI. This is a picture of one of the children who participates in our study, Casey, and she's in the imager, and she's looking up through a prism, and she has a button box in her hand. And the tasks that we ask people to perform in the magnet are, in fact, just the same sorts of things that Sally's just been talking about. We ask children to identify nonsense words, to sound out words. And using that technology, scientists around the world have really developed a convergence of findings that there are at least 3 neural systems for reading. They're all in the left hemisphere. This is a cartoon from Sally's book. We're looking at the left side of the brain. Here's the frontal lobes and the parietal lobes and the temporal lobes. And there are 3 systems for reading, 1 in the front of the brain and 2 in the back of the brain, all on the left side of the brain. And what's been learned over the last 2 decades is that there is in dyslexic readers, there's an inefficient functioning of those systems in the back of the brain. These are images from our own studies of about 200 children. And here's what's called a meta-analysis, more recently, of 17 studies around the world showing these same systems. Here are the 2 systems in the back of the brain and a system in the front of the brain. They correspond to this cartoon here. And you'll see that these same systems are found in studies around the world. Now, there's another way of representing this, and that is that in typical readers, if we're looking at the left side of the brain, here's the front of the brain and the back of the brain, typical readers activate these systems in the left side of the brain. In dyslexic readers, there's an inefficient functioning of these systems in the back of the brain, perhaps a little more activation in the front of the brain. And this picture of inefficient functioning of the systems in the back of the brain is what people have termed a neural signature for dyslexia. And what's so interesting is that this neural signature is seen in every language. It's been seen, this is an image from a paper by a colleague of ours, Araldo Palasu, who's a neurologist in Milan, Italy. And Palasu studied college students in England, France, and Italy, and found that there's an inefficient functioning of those systems. This is the front of the brain and the back of the brain. There's an inefficient functioning of those systems in the back of the brain, regardless of the language spoken by the college students. And those same findings have been very much replicated in German students, German-speaking students, and for the most part, similar but not exactly the same in Chinese. So this is a very universal finding, this inefficient functioning of the neural systems for reading. And what we also have learned is that one of those systems, let me see if we can, this system in the left side of the back of the brain, shown in yellow, is really critical in reading. And it seems to be responsible for integrating the sounds of spoken language, the way the language looks on the page and the meaning of the language. This is a blow up of that area in the brain. And so this seems to be really critical. If this area doesn't get to integrate all the systems that you need for reading, then people continue to be very slow readers, continue to be disfluent. I showed this slide. This is one of our most recent studies where we're trying to not only see which systems are involved, but how those systems are connected. And this is, I purposely chose this slide because it shows the complexity. We've studied the connections in the brain in typical readers and dyslexic readers, in young readers and older readers, and you can see the tremendous amount of connectivity involved. There are differences in dyslexic and typical readers. Dyslexics are shown in blue, typical readers in red. There are differences in the way those systems are connected, and there are differences in younger compared to older readers. But this is sort of the next stage of how we're learning about dyslexia. How, not just here's a system that's involved. It's not just phrenology anymore. It's how those systems are connected. And I think that's really going to be the next stage in the evolution of our understanding of the neural systems in dyslexia, and also in other disorders as well. So let me just summarize. Brain imaging has really been critical in helping us understand dyslexia. It, first of all, has shown in a replicable way around the world in every language a neural signature for dyslexia. A word of caution, I always have to say this. These findings that I'm showing you are in groups of dyslexic readers compared to groups of typical readers. The technology is not sensitive enough to show in an individual case, but it's replicable in groups of people. So there's a neural signature for dyslexia. That is an inefficient functioning of those neural systems for skilled fluent reading, particularly that system I showed you in yellow, what's called the occipital temporal system. And the importance of this is that it's made visible what previously was a hidden disability. Dyslexia is real. We've known that from many other kinds of studies, but it's very vivid when you see it in an image in the brain. Sally's going to come back now and tell you how we've taken some of these findings from the epidemiology and understanding the cognitive basis and the neurobiology to translate this scientific progress into practice.
Okay. And Bennett and I are very excited to be scientists, to do brain imaging, but what we really care about is people. And so the really important part is, how does the science tell us what to do? And the other part of it is, you have to listen. And you can't have the science say, wasn't that neat, and then go about doing things in the same old way. The truth of the matter is that we know as much or more about the scientific basis of dyslexia, as you just heard, the neurobiology, the diagnosis, the management, than most other entities. Bennett and I attend on our acute pediatric ward, and we'll ask the interns and residents, what do we know about renal disease or this? And I'll hear the answers, hey, we know more about dyslexia. But people just don't understand that we know that. So we believe it's inexcusable in terms of what it means for a child or an adult's future to miss the diagnosis, because that can lead to effective evidence-based intervention and determine the course of a child's life. And one of the things I think we have to do is put the pieces together. It's about children and not numbers or not parts. You have to see the whole. And sometimes people will come to me and say, would you read my child's evaluation? And I will go through 30 pages, and I feel like I'm walking through a bramble bush. And I hear about this process and that process, and I come to the end hoping it's put together, but it's not. And I think there's a huge need to synthesize the information. Here's the example. If a child has had such an evaluation, and you say, well, what do you have, Olivia? The response is likely to be, I have problems with auditory processing, processing speed, rapid naming, working memory, letter-word identification, pseudo-word decoding, and reading fluency. Oh, and I do better in comprehension, long-term retrieval, fluid intelligence, and visual spatial processing. What does that mean to Olivia? What does that mean to her parents? And what does that mean to her teachers? On the other hand, if you put the pieces together and you say, Olivia, what do you have? She says, I'm dyslexic. Nothing about me, and this was the answer for a young man we saw actually on the West Coast. I am dyslexic. Nothing about me has changed. Only now I understand what is happening. It has a name, and I know others who are also dyslexic. And here's the same little girl, and she tells you what it felt like when she didn't know what she had.
The thing that was really difficult for me is that I didn't really realize what I had, so I would always think I was dumb. And it was just really tough.
She seemed very anxious, and then she would call me from the nurse's office, and she had stomach aches, and then I think that she just at one point said, my brain isn't working. I don't know what's going on.
What I want to transmit to you is dyslexia is an entity. And what we now know is that the origin of the difficulties is getting to the sounds of spoken words. And that's important because it predicts what are the difficulties going to be. They're not unrelated parts floating in space. They all come from a difficulty in getting to the sounds of language. So we know that very, very often there'll be a problem getting to the sounds of words, so there might be some delayed speaking and difficulties with word retrieval, and I'll go over that in a moment. If you have difficulties getting to the individual sounds of words and you can't pull them apart, you're gonna have trouble sounding out words, learning to read, later on reading fluently. You'll have difficulty with spelling. You'll have difficulty often with handwriting and learning a foreign language. So just in terms of spoken language, the symptoms that we look at are delayed speech, lacking of verbal fluency, mispronunciations, person's not glib, and they'll have word retrieval difficulties. It sounds like so easy, but when you have it, it's not so easy or pleasant. You need time to summon a verbal response when questioned. You struggle to retrieve words, and the feeling is the word is on the tip of my tongue, but I just can't get it out. And imagine the teacher saying to you, what is the cause of this? Oh, I know it, but it's not coming out. And what happens, people get to know that this is what they have, so they avoid saying words that they may mispronounce. So their spoken language vocabulary is much smaller than their listening vocabulary. And here's a friend of
There
mine.
are others who have dyslexias, who have problems with pronouncing words and saying words in their correct sequence, etc., just like they do with reading. This can be very upsetting to them because they are often laughed at, or people make fun of people who do not speak fluidly or sometimes mispronounce words or use words incorrectly, and that can go with the dyslexia. That does not mean that they're not intelligent. It does not mean they don't know what they're talking about. It just means usually when they're in public, a combination of their dyslexia and anxiety and all the history of being humiliated comes to bear, and they don't present themselves in the best light.
So here's the mechanism, and we're very excited about that. So here you see a typical reader. If you want to say the word bat, you think of the concept bat, and you are able to draw up the abstract representation of the semantic meaning of the word. And then, in order to utter the word, you have to transform each of the letters into its sounds, the b, a, and t, because it's believed that it's the phonemes that program the articulatory mechanism and allow you to utter the word. No problem, automatic, quick, no-brainer. If you're dyslexic, you don't have problems with the thinking, the conceptual part. You can think of the concept. You can even think of the semantic representation. But when you have to transform those letters into the sounds, you're in deep trouble to accessing and retrieving the sounds. So what happens? Either ums will come out, or you'll mispronounce like Presbyterian instead of pedestrian, and you'll get very anxious. And as you get anxious, you have a reverberating cycle of even more difficulties. So the clues to the identification of dyslexia, the problems we spoke about in spoken language, difficulties in learning letters, letter sounds, sounding our words, avoiding reading out loud. Bennett and I have had the privilege of speaking to many people who are dyslexic as adults and who are really incredibly accomplished. And you ask them, what was school like for you? Their face drops, sometimes there'll be a few tears. I remember the horror of being called on to read aloud in class. Sometimes their fellow classmates are not very kind. Sometimes teachers aren't very kind. And being a slow reader. People mistake slow reading for slow thinking. Dyslexics are slow readers because they're not fluent readers. That yellow area, the word form area, is not working efficiently. So they can't integrate the sounds, the spelling, and the meaning, and they're reading manually instead of automatically. Spelling problems, poor handwriting, but great typing. And this is really important. Each of us has a bucket of attention. If you are a manual reader, you're going into that bucket and taking out that attention. So what happens? You run out of it. You get tired, you get distracted. And also, you want to make sure people, when they take a test or when they're doing anything requiring a bit of reading, that they're in a quiet room, because if they're distracted, oops, there goes that bucket of attention. So that's very, very important. It's not that they're not trying. They're trying harder than anyone else in the class, but you just can't see it. And they're consuming that bucket of attention. There's also a comorbidity between attention deficit hyperactivity disorder and dyslexia, but there's also a separate impact of attention itself. As I mentioned, difficulties with foreign language, and the reason we really care about this is what it does to your self-esteem as you grow up. Nobody enters school thinking, oh, I'm not going to be a reader. And when you get all of these hits, and as someone told me, you never know when it's going to be coming, that does something to you. But we have to remember, we developed a conceptual model of dyslexia that we refer to as the Sea of Strengths model. And that says dyslexia can best be conceptualized as encapsulated circumscribed weaknesses. Early on is just getting to the sounds of words. Later on, primarily shown as slow reading. But at the same time, surrounded by a sea of strengths and higher level cognitive thinking, reasoning, concept formation, creative thinking, problem solving, vocabulary, critical thinking. So the goal is to identify the weakness, to identify the strengths, to remediate the weakness, and also to have access to the strengths, which is most often done through accommodations. And what I always tell dyslexic people I see, in a sense, you're lucky. We know how to teach people how to read. That's your problem. But we don't know how to teach people yet quite how to think. So that's what you can do well. It's the reading that's the difficulty. So the management is prevention. Children who are behind early on, there's data from everywhere that shows that, remain behind. So we now have the scientific and practical know-how to prevent reading failure. And the question is, do we have the will? We know what to do. Now I'm going to say a few words about accommodations. They're really critical. By themselves, you're not giving people the answers. They don't produce success, but they're a catalyst that allows success to happen. Basically, dyslexia robs a person of time, accommodations return it. And what's so exciting now is that we have neurobiologic evidence of the need for extra time. So here are some of the cartoons Bennett showed you. This is a typical reader this is the word form area that facilitates automatic reading. And here in dyslexics, this area is just not functioning efficiently. You have some compensation. This is on the left and the right, frontal regions, and also the homologue on the right, posteriorly. But this you don't have. So what happens is, because you do have these other systems, it allows you to read relatively accurately. But because that word form area isn't working, you can't read automatically. So what happens? If you're a typical reader and you see a word, it's like you're on the express highway. Whoosh, you got it. If you're dyslexic, it's as if that highway is blocked, and you have to get off the superhighway and take a country road. It's bumpier, it's more circuitous. You have to work hard. You'll get there, but you'll be a lot more tired, and it'll take you a lot longer. In terms of oral exams, they may not allow the demonstration of knowledge and skills, especially in an artificial anxiety-provoking setting. You need to minimize the factors exacerbating anxiety. And it's important to know that these high-stakes tests, they're the access to college, graduate school, and professions. As mentioned, I wrote a book called Overcoming Dyslexia, and in the epilogue, I wrote about people who are dyslexic that you wouldn't imagine could be dyslexic, like John Irving, the writer, and Toby Cosgrove, who's the CEO of the Cleveland Clinic and a great cardiac surgery and a good friend. And here's what often happens in schools. I'm showing it so no one else makes this error.
A social studies teacher
He's a
asked me
surgeon
what I
in New
wanted
York.
to be when I grew up. And I told him that I wanted to become a doctor. And I remember him sort of laughing under his breath and saying, well, I just don't see you as doing that, Tyler. That requires a lot of reading, and I don't think medical school will be for you.
And Tyler Lucas is a wonderful orthopedic surgeon in New York now, and quite successful, and his patients are grateful he didn't listen to his 8th grade teacher. So we're going to finish up the pillars of policy. Dyslexia, it's not about numbers, it's about people. It's a clinical diagnosis, but you have to understand it. You have to know all these difficulties getting to the sounds of spoken word and what that creates. So it's based on the history and observations, clinical judgment, and not cutoff scores. It's not outgrown. Test scores are a proxy. The reality of life experience is really what counts. Instruction needs to begin early on and be evidence-based. Accommodations are critical in order to measure ability and not disability. And this is one of my favorite cartoons that we've had drawn. This shows an iceberg. And when I think about dyslexia, it makes me think of this iceberg. You know, in an iceberg, you only see 10%. 90% is underwater. So here I've tried to show the people we see often who are dyslexic: Charles Schwab, David Boies, Toby Cosgrove, John Irving. They've made it to the top. And we have lifeboats. If you have the lifeboat of instruction, or accommodations, and Dylan, you're there. And that helps you get stopped. But we can't forget the 90% who are there asking for help, needing help. We know what to do to help them. And my question is, why don't we damn do it? So urgent action is needed. We need a lifespan perspective. It shouldn't be like Sophie's Choice. Do we help the young children? Do we help the adults? We have to have big enough hearts and big enough minds to help everybody. Again, early diagnosis, evidence-based instruction. And it's not simply about teaching reading. You require the big picture of understanding all the parts that are dyslexia. And even with the best instruction, most people with dyslexia will not read rapidly and automatically. They'll have word retrieval difficulties, spelling problems, foreign language problems, and the anxiety will persist. So I want to thank you. These are my 2 other granddaughters walking to school happily, and we wish on everybody else. So thank you for your time and attention.
I want to thank the Drs. Shaywitz from Yale, who've come all the way down to bring us really compelling information. I'm not ready for my test yet, so I have to review the information. But really wonderful, wonderful things. And we look forward to seeing you again here at Hunter. I'm going to open the floor now for questions for Dr. Bennett and Dr. Sally Shaywitz.
The first question is, are there musicians who are dyslexic? Yes, they are, and we've had one of our fellows look into brain imaging of dyslexia and musicians, and there's no clear picture. What I will say is that we have seen children who were good enough in their singing, for example, or their music, to be in the Connecticut State Choir or Orchestra, but they couldn't pass the written music test, so that's something to be very well aware of.
This is about dyslexia in the preschool student.
What does dyslexia look like in the preschool student who has been identified with learning delays? Well, the good thing, if you can say that, is that it affects spoken language. So you look for evidence of delayed speech, mispronunciations, and also in the preschool period, remember, dyslexic people have trouble focusing and being aware that words have parts. So in preschool children, what words have parts? Rhymes. So children who are dyslexic often don't get rhymes or can't tell you, does this word rhyme? So that's a really important clue. And what's also good is more and more tests are coming out of spoken language, of phonology, that are appropriate for preschool children.
Next question.
Okay, this is a good one. Are there any research findings that indicate dyslexics have special gifts or skills due to dyslexic brain? Are there any valid findings? No. And the reason is because if you're creative, what's the task? People have creativity in different areas and different dimensions, so that people have developed their own personal narratives. But in terms of being evidence-based, we don't have that. Doesn't mean it doesn't exist. We just don't have the science yet. We have the anecdotal information. For example, people have looked at entrepreneurs and found 30 to 40% of them are dyslexic. Oh, here's a question. How do we encourage better diagnosis in New York State? The IEP is so vague, and rarely is there a definite diagnosis. I agree this can empower students and teachers. How can we help? I think we can help by whatever can be done to make dyslexia a discrete entity and not fold it into, there are a lot of different learning problems, many we don't know about. But don't throw dyslexia in there because then it gets washed out. Have it as a specific entity, have the testing be to reflect that entity, and have IEPs reflect the whole. You can break it into parts after, but at least reflect the whole. And I know we have members of the Board of Regents, and I think Dr. Steiner is here somewhere, and others. I love this question because what it says is we have to act. And maybe we can have a group of people get together and say, how do we represent dyslexia, but at a state level and at a city level? And I know we've had experience in the past meeting with, is it Chancellor Walcott or Superintendent?
Superintendent.
And he's a great person
Chancellor.
who really wants to help children.
School's chancellor.
School's chancellor.
Last one. For now.
Well, the same question. What have you found in the relation of dyslexia and creativity? Does dyslexia encourage people to become all kinds of artists? And this is something I want to address. We studied and began to study dyslexia and creativity, but it all comes down, how do you define it and how do you measure it? And I don't think we have the answer to that. There are many, many dyslexic people. You mentioned the great artists, architects, poets, they're dyslexic. But that gives the wrong idea. We have the example of a dyslexic who's a great doctor that we're honoring today, Dr. Harold Koplewicz. There are dyslexics who are great writers. There are dyslexic who are great attorneys, great teachers. So I don't think we should shove all dyslexic kids. I know of many dyslexic children who don't like art. So we shouldn't be guilty of saying, well, you're dyslexic, you go that way. One of the scariest things I ever had was I took time off when my children were young, and I was my twin son's kindergarten class mother. Imagine that one. And I remember the teacher testing children and putting them in different groups, and I said, oh my God, they're never going to get out of these groups. And it wasn't even my children, it was other children. So I think just we should look at what children like to do, and I'm just going to take another minute. And as a mother, I know how badly we want our children to succeed, but it can't be a 24-hour-a-day thing. We have to find what children like, what they're good at, and it doesn't have to be art, and what makes them feel good. And there has to be time for them to be able to do that.
We have another brilliant speaker talking about a totally different topic of autism, Dr. Cecelia McCarton, who is also an MD and has founded the McCarton Center here in New York City, and is just here is everything you always wanted to know about autism, but we're not going to say it all now. We'll tell. But the McCarton Center and Dr. McCarton will perhaps shed light on the latest research and what are some of the things that you can do with kids in school and in your home. Dr. McCarton.
Good morning, everybody. It's very nice to be here. When Paula asks you to give a talk, you, of course, as Dr. Steiner said, you agree immediately. But the caveat that she gave me was that you have 15 minutes. You have 15 minutes to tell the entire audience everything you know about autism. So needless to say, we're not going to accomplish that today. And when you compare this talk with the talk that the Dr. Shaywitz just gave, you'll see that autism is at a very primitive point, extremely primitive point. I can't put anything up in terms of slides that show you a particular part of the brain that's affected. I can't show you connectivity slides. We have a long, long way to go. And much of that is because up until about 7 years ago, there really wasn't very much research going on with autism. And it's really only with the establishment of Autism Speaks and Bob and Suzanne Wright and their campaigning in Washington that we've been able to get money to do some basic research. So I hope, not 15 years from now, but I hope in the next few years we'll have a speaker up here who'll be able to give you the kind of presentation that the Shaywitzes just gave you. Well, let's just start off with autism. Everybody knows what autism is. It's in the newspapers, it's on the grocery line, it's in People magazine, and it really encompasses 3 areas. There's usually a language deficit, both expressive and receptive. There's a difficulty with social interactions. There's a lack of interest in peers, sometimes a lack of interest in adults. Very content to be by themselves and to do what they want to do. Restricted interest. They'll do the same things over and over again. And their play is very limited because of these restricted interests. The prevalence, according to the Centers for Disease Control, is now 1 in 88 children. And that translates out into about 1 in 54 boys and 1 out of 252 girls. It's actually rather astounding to look at these figures. I would say probably autism and dyslexia take up the entire world. Right, right, exactly. The etiology is really thought to have 2 components. One is certainly a genetic component. The problem here is that there's never been an isolated gene. There seems to be a multiplicity of genes that are involved and a multiplicity of gene loci that are involved. So it's very, very hard to tackle this. Also, there seems to be some kind of environmental issue. There's something environmentally that triggers these genes into a malfunction. That we don't know, and unfortunately, that area of environment is the one that gets tremendous speculation and sometimes some wild theories that come up in terms of what that environmental issue may be. And we just have to be very, very careful about the environmental issue. I think it stands to reason that genes and environment play on any kind of disease entity. there's always a genetic predisposition to get something, to get heart disease, to get cancer. But what makes one person get it and another person not get it? And that's where we're really struggling here. We're struggling on both fronts. So I'm going to talk a little bit. The talk will be divided today into some research, some things that are accepted now by studies, by good studies. They've been objects of speculation in the past, but now there's good studies to say that these things do have some relevance in autism. Then we'll move on to intervention and what you can do about autism, and then the challenges that we face. So let's talk about one of the risk factors that's certainly gotten a lot of press, again, no matter where you picked up any kind of reading material, and that's the advancing paternal age. And this study really, or this finding was really solidified by an Israeli study that was done that had over 130,000 individuals in it. And when they looked at this, and they looked at these records, and they identified within this cohort of 132,000 individuals those who had autism. It turns out that individuals whose fathers were 40 years of age or older, there was almost 6 times a greater risk of developing autism, as opposed to individuals whose fathers were 30 years or younger. So those of you out there who want trophy wives, be careful, okay? Women are getting their vengeance now. And I'm happy to say mothers are blamed for everything in this world, but there was no association with maternal age, none, okay? So this is one of the first times that we got off scot-free. Oh, sorry. I'm not sure if there was a reply to that or not. All right, the second area, and, oh, sorry. I'm on the wrong slide, right? Yep, okay. The second area is really the association with schizophrenia and bipolar disease, and probably Dr. Koplewicz would be an expert on this. I'm just going to give you a little blip on it. There's a group called the Psychiatric Genomic Consortium, and actually there's an American that heads it, and he's down at the University of North Carolina. This consortium really is a conglomerate of 19 countries and 60 institutions throughout the world. And they look at cohorts. There was a very, very large cohort in Stockholm, Sweden, another one in Greater Sweden, and then an Israeli cohort that was looked at. And what they found is that if a child has a sibling or a parent with schizophrenia, in the Stockholm group, that individual had 3 times a greater chance of developing autism. In the Israeli group, they had 12 times a greater chance of developing autism. And it seemed to be associated with genes that were on chromosome 15, 16, and 22. So there's some association between schizophrenia and autistic spectrum disorder. It seems to be focused around these particular chromosomes. What the genes are, we don't know. What the variants are, we don't know. And what the association is, we still don't know. And that's obviously a challenge in terms of trying to figure this out. Now, there is an association between schizophrenia and bipolar disease. So this group also looked at this association. And it turns out that if you have a parent who has a bipolar disease, a child who's born has about twice the chance of developing autism. So it's not that this hasn't been alluded to in the past in psychiatric journals, but because of the magnitude of this study, and the numbers that were involved, it really seems to be something that we can say, let's look at this. There's something here in terms of this overlap between schizophrenia and also autism. If you remember correctly, if you remember your history in terms of the history of autism, early on, autism was called childhood schizophrenia because there are many children who present as if they have psychotic behavior. So there's some kind of link here that deserves more obvious consideration. I'm going to try to go back to the slide that I missed. Okay. This is some research that was done on early detection. Now, everybody wants to know, am I going to have a child who's autistic? And that's the question everybody asks. Or if I already have a child, I want a second child, do you think he's going to be autistic? Because everybody's autistic now. There really isn't any prenatal test at all. There just isn't. The only thing that's come our way, there are some tests if your child already has autism. There's some MRI work that's done that can identify with about a 94% accuracy high-functioning individuals with autism. But we already know they're autistic, so that's not helping people who want to have babies. So there's a blood test that's been developed now, and the blood test really, this is out from Boston Children's Hospital, took a conglomerate of 55 genes. And what it does is that it analyzes the individual on these 55 genes. And you get about a 70% accuracy. So if you're a scientist, you don't think this is so great. However, it's more than we've ever had before. So if it turns out that you are positive, you are at great risk of developing autism. If you don't have it, if you don't come up with these markers within these 55 genes, you are not at risk for developing. So there's more work being done on this. These particular researchers at Boston Children actually signed this over to a company called Synapse Diagnosis. And they're developing this test further to see if we can get it to a greater percentage. We'll see, but it's a start. All right, now, this is a hot topic because it's going to bring about probably a lot of questions. If you take care of autistic children, inevitably parents will come to you and tell you that their child has GI symptoms. And often the GI symptoms are chronic diarrhea, abdominal pain, severe abdominal pain, bloating, abdominal bloating, and sometimes they'll say, oh, my child, all he does is pass gas all the time, all the time, all the time. It's really embarrassing. Now, there's a whole segment of individuals within the autistic community who have believed for years that if you change the diet of a child, if you put these children on gluten-free, that's wheat-free diets, if you take away milk, this will help very, very much in curing these symptoms. Most of these individuals have been called quacks and charlatans, and people have said this is ridiculous what you're advocating because you're putting these children on very strict diets. And some of them, some children that I've seen have been put on wheat-free, dairy-free, soy-free, sugar-free, corn-free diets. I don't know really what there is left to eat in our particular part of the world, but this is what these children really exist on. So there's a very, very good collaboration that came about between Columbia University, the Mailman Center in particular, and Harvard. And they did biopsies on children who were autistic, who presented with chronic diarrhea. I really want to emphasize this. Okay, they didn't present with constipation. They didn't present as picky eaters. Okay, they presented with chronic diarrhea, and they did biopsies on these children. And what they found was that there were abnormalities in the enzymes that break down sugars. The enzymes are called disaccharidases, and they break down the sugars to single units, monosaccharides. So there was an abnormality in the genes that monitored and created these disaccharidases. There was also an abnormality in what we call the transport of the sugar from the inside of the intestine into the bloodstream. So you have two abnormalities going on here. And what resulted, because there was an enzyme that wasn't really functioning correctly in breaking down this sugar, was that you had undigested carbohydrate or remnants of carbohydrate, and on top of that, floating through your bloodstream, and on top of that, it was affecting the bacteria that really was in your intestines. Now, there's a wonderful book out called The Second Brain, and it talks about your intestines. It talks about the gut. And it says that your intestine is your second brain. Pretty much many of the receptors that reside within your brain also are in your intestines. So, what can happen is that if you have undigested carbohydrate and you have bacteria who are upsetting the whole equilibrium within the intestines, you can get, first of all, GI symptoms, but it can also affect your immune system, and it can affect just overall behavior. And that's why among individuals, parents, and even some doctors have said, well, if you put the child on an antibiotic, or if you put the child on an immune-enhancing regimen, these children get better. But that was the tale. It really wasn't addressing what the issue was. So I'm not saying now every single child with the diagnosis of autism should be placed on a gluten and a casein-free diet. I am not saying that. But I'm saying there is a subset of children who do present with chronic diarrhea that should have this investigated further to find out if they do fall into this subset and are lacking the necessary enzymes to break down the sugar, because there is something you can do about this. I don't want to be seen in the New York Post tomorrow saying that I advocate gluten and casein-free diets for every child who's on autism, okay, who has autism. All right, let's go on to intervention. There's a few more things on research, but I really do only have 15 minutes. And I think Polo comes out with a hook at that point. The interventions that I'm going to talk about really are from the American Academy of Pediatrics. There was a technical expert panel that was brought together. This was really published around in November of 2012. And the title of this, in case anybody wants to look it up, is Non-Medical Intervention for Children with Autistic Spectrum Disorder, Recommended Guidelines. This consisted of a panel of physicians, parents, and researchers. And what they did was they systematically went through over 350 articles, and they tried to separate them out with very, very strict criteria in terms of what works and what doesn't work. What they found was that applied behavioral analysis, often called ABA, was very, very effective in increasing the IQ of autistic children, their communication, and also their adaptive living skills. Now, the ABA within this article had many components to it. It just wasn't strict ABA, because one shoe does not fit everybody. The ABA in these articles also had a social component and a play component connected to it. And I'm happy to say that's what we utilize in my school, so that it's just not a robotic or a mechanical approach to the child, which is not really learning. Generalization is very, very, very important, and that's why you need these other components with it. They also found out that the intensity was very important, and they were strongly advocating at least 20 hours a week of this behavioral intervention. And the duration was important. It wasn't something that you could do in 3 months and get a result, but it might take months and maybe even years, with the behavior intervention changing as the child grew older. And there's been some studies that have come out indicating, because of electrophysiological work and EEG work, that some aspects of brain functioning can really change with this early behavioral intervention. So there's been some work done on the ability to look at the face. And what will happen is that initially when you look at these children who are on the spectrum, their electrophysiological readings will be quite abnormal. But as they get behavioral intervention, again, over the course of maybe 18 months or 24 months, you'll see that the electrophysiological functioning and even some aspects of the EEG really resemble that of a normal child. So it's so primitive what I'm talking about. But it's the beginning. It's the beginnings of saying that we can connect neural substrates, changing neural substrates with early intervention. Early intervention is critical no matter what your disorder. The younger you get at it, the better off the individual is going to be. And this, of course, has taken the whole world by storm in terms of intervention, and that's really the world of Apple, if you will, or the world of technology. And I think we're going to have a talk about that as soon as I get off the podium. But it's opened up a whole new realm to our children who are on the spectrum. Many children who are on the spectrum are nonverbal, and they never really had a chance to express themselves before. They're visual learners. Their visual capacities are incredible. And many children who are on the spectrum really are quite bright. And it's never really been recognized before. We've dumbed them down. We don't give them credit for their intelligence. They see things in a different way. They see things visually. They don't see things in words. They don't understand words. The processing is not there. But visually, they're magnificent. So the iPad and the iPhone has really allowed us to really get at that. And I don't think that Steve Jobs ever knew what he was giving the world of special education. But I think that we all owe him a tremendous thank you. There's apps for everything now. There's apps for learning language. There's apps for drawing. There's apps for social interaction. There's apps for learning adaptive skills. All of these things we used to have to make movies about years ago. And it was very time consuming. But now it's really just incredible. And everybody walks around with an iPad, right? So our children don't look very different. They look like they really fit in, which is great. These are the challenges that lie ahead for us. And as I said, we're at very early stages. Even though we may say that behavioral interventions work, we don't know what aspects of behavioral intervention work. And so what happens now is that everybody gets 20 hours of this and 5 hours of speech and language and 5 hours of OT and sensory integration, and you get social skills training, and then you belong to social skills groups. And so everybody gets the same thing. But we haven't identified the critical elements that are involved that make the changes. And that really is absolutely necessary, because we all know that there are subsets within autistic children, subsets, and we've never identified those. And some will respond to some therapies in one way, and another subset will respond in a different way. So we're really at the beginnings, but we have to begin to tease this apart. We do have what I call an aging population. Most of the interest in autism has been on the young child, and we've forgotten that they get older, and they grow, and they have birthdays. And so we have the teenagers now, adolescents, and the young adults, and it is clearly something that nobody is prepared for. It's an absolute tsunami that's coming at us. And we don't know what to do with them. We don't know how to adapt our teaching skills to them. We don't know how to go about vocational training with them. 80% of the individuals who are adults who are on the spectrum are unemployed. Well, what do you do all day if you're unemployed? Do you go to the movies? You go bowling? I mean, what's the reason for getting up in the morning? So we have to begin really to think about what to do with our individuals, our children who are getting older now. Access and cost of intervention is something that plagues everybody. Access, there's the numbers of individuals who get identified as being autistic outstrips any kind of resources that we have. And so there are long waiting lists. What happens is that we know that they need intensive intervention, but what will happen is they'll get very little intervention because everybody's trying to make the pot stretch as far as it probably can. But just like more is not better, less is not enough. And so we really do have to have more services for our children and young adults who really are on the spectrum. The cost of intervention, it is prohibitive when you speak about the many, many hours that are involved. And I understand that it can strip a school district of all of its resources. And I understand why superintendents in school districts are pulling their hair out because of the incredible cost. So we have to think of ways of doing things, again, by trying to find the critical elements that really work within an intervention and not giving everybody the entire kitchen sink. The quality of the teachers and therapists is, again, something that is absolutely at the forefront of concern because there are so many children with autism. We've been grinding out therapists very quickly and grinding out teachers very quickly, but they don't have the necessary skills and training and primarily experience to really know what to do with our autistic population. And it becomes very clear very quickly who are the experienced ones and who are not the experienced ones. Medication usage in ASD is something that is very, very alarming in that there is no medication that can cure autism. The medications that are used sometimes really can have an effect on some of the behaviors that we see. But it's not dealing with the core deficits within autism. But if you read all of the reviews that have been written about medication within the spectrum disorder, parents are extremely concerned about putting young children on medications and what it might do to them developmentally. The side effects are there and they're prominent, and quite honestly, many of these medications are absolutely ineffective. So we do need some more research, and the pharmaceutical companies are just getting interested in this now. Lastly, something that can't be overlooked and that really has to be a part of every conversation about individuals who are on the spectrum really are the parents and the family. Parents really are stressed, unbelievably stressed. They are anxious about choosing the right interventions for their children, the amount of intervention, the quality of the intervention. They're stressed by financial issues. They're stressed by time constraints. How do they get the children to all of these appointments? How do they manage their lives? How do they take care of their other children? What about their marriages? And we just presume that people are going to do this. Parents are the real heroes in all of this. They really are, because what they do is superhuman. And we just ask it of them. often they don't have any resources. We haven't allotted resources to them. We've allotted resources to the children, but not to the parents. And that's something that we really have to think about. So thanks very much, folks, for your attention.
I can't help but think about Leo Kanner and the refrigerator parents. The early diagnosis of autism many years ago blamed the refrigerator mother. And we've come a very long way in our thoughts about autism today. And thank you for bringing us up to date, Dr. Cecelia McCarton, who, by the way, does private practice as well as having a fabulous school for autistic spectrum children. I'd like to welcome the next speaker. Professor Liza Burns has traveled all the way from Vermont today, from Landmark College, and we have somebody else who came in from Vermont today. We'll meet him later. Liza will bring us up to date on assistive technology and special education, and just exactly what Dr. McCarton mentioned now, how we are making such advances in that realm for so many different types of learners. Professor Burns.
Thank you. And I'll first start by closing the camera that I did not mean to turn on. I meant to do that. Hi, thank you very, very much. I'm really excited to be here all the way from Vermont. I didn't get lost except for this morning on the subway, but here I am and I'm thrilled to be here. I'm really honored to be included in such a prestigious group of professionals, people I've been reading about, I have my students read about, so thank you very much. I'm here to talk about technology, and I think I want to say first and foremost, I'm a special educator, and I've been teaching special ed for nearly 25 years. Most of that has been at Landmark College, where I've been lucky to work with students, LD students, in a program where we incorporate assistive technology with the curriculum. So I have a lot to show you. I know I don't have a lot of time. I hope I don't speak too quickly, but I do have handouts, and I have a resource page which will have websites and information for anything that I demonstrate today. So I'm going to get right to it. Today, again, main idea, before the details, I want to talk a little bit about Landmark College where I work. Then I'm going to show you some reading tools, some study tools, and some writing tools. So I have a lot to show you. First, let me tell you a little bit about Landmark College where I teach. Landmark is just up the road here in Vermont, about 5 hours. It's a small college. It's a small college exclusively for students with learning difficulties. So all of our students some have dyslexia, some are on the spectrum, or ASD as we call them now. Some have attentional issues. Many have a little of all. At Landmark College, our mission is to transform the way students learn, educators teach, and the public think about education. We have a number of different programs at Landmark. We're, of course, an accredited college. We've been offering a number of associate's degrees for over 25 years. We're really excited to be offering a new associate degree in life science and one in computer gaming. And we're really excited, under some new leadership we have with Dr. Eden, we're now this year accredited to provide the bachelor's program. So we're very excited to be doing that. But I want to focus here on the skills development program. For many students that you work with, they may not know that they are not prepared to meet the reading and writing and learning demands of higher ed. So we have a skills development program at Landmark College, and that's the program that I primarily teach in. That's for students who've graduated high school, but still need to develop their study skills, their reading skills, their independent skills. So you could think of it as a 13th year maybe, but it's a program that students enter and they build their skills until they're successful enough to be successful and independent at the college level, which they stay and go into the associates or now bachelor's program at Landmark. I should mention too, because I think this is a K-12 audience, we have a high school program that I've directed a couple of summers. It's a really exciting program in the summer where high school students can come to Landmark and really get a sense of what is college like. Many students are very unprepared, and so they get to live in the dorms, they take classes during the day. They are, I think, probably the most powerful part of the high school program is that they meet other students from all over the country and world who also have learning struggles, and they are not the only one in the classroom or their school. And they bond amazing friendships in that experience. So the high school program are for students who are in the summer about to be a junior or about to be a senior. And I have more information about that if you're at all interested. So I want to talk to you about the skills program that I teach in. It's called the Language Intensive Curriculum, where we build the technology into the curriculum. We don't teach technology for technology's sake, but it's always connected to the skill, the study skill that we want students to learn. So skill instruction is explicit, and then so is the technology skill is explicit, and they learn to use them together. For example, reading is an active process, and we want students to actively engage in reading. So we teach them how to pull out the main ideas. Many of you do, I'm sure. And that's the skill we might look for. And then we'll open up the Kurzweil, which I'll show you in a moment, the software program that we use at Landmark, and then teach them how to do that using the technology. So again, it's always in tandem is the skill instruction and the technology instruction. We know there are many benefits to technology. We all use technology. I see phones out, and we're always on technology. We know that it has enhanced student performance, so students are engaged more in learning, regardless if they have reading disabilities or attention and disabilities. We know that students can be engaged with technology for longer periods of time than, say, a book and a piece of paper. Because of that engagement, it taps into the multimodal ways of learning. They end up spending more time learning and being more motivated to learn, which is what we're looking for as educators. We want time on task to be extended. And also organizing. Both organizing their ideas and organizing materials is made so much easier using the technology. Another real interesting thing that we've discovered through the research, but also in our anecdotal experience at Landmark, is that let's say 10, 15 years ago, we used to think using the software programs might have been a bypass method, where we're helping students to get around their weaknesses. But we really had to break ourselves of that thinking. We now know that using technology tools enhances students' language skills. So dyslexic students, for example, who have a challenge with reading, now that they can use a reading software, their reading comprehension improves and their reading fluency improves. So by providing the technology, that scaffolding, they actually are increasing their language skills rather than just working around them, including the vocabulary, which I'll talk about in a moment. I want to be mindful of my time. Will you remind me if I'm getting long? Okay, reading tools. Here's where I'm going to do a little more of the show and tell. I won't get into the neuroscience of reading. We just heard a lot about that and how complex it is for all of us, and especially students who learn differently. We use at Landmark, as I mentioned earlier, Kurzweil 3000. And before I talk too much about it, I'd love to see a show of hands of people who know or use Kurzweil in their schools. Okay, that's good. I think I'll go ahead and show you the demonstration then. If it was most of you, I wasn't going to really show you. But Kurzweil is one of many different reading software programs that you purchase. You can purchase. Many laptops now come with reading ability. We love Kurzweil at Landmark for many reasons. It has an incredible and robust suite of study tools. Here's a screenshot of what Kurzweil looks like. We have the basic study the basic toolbar right here. And so basically it's a reading software that reads aloud and tracks the words as students are reading. We know that using technology allows students to individualize the learning environment. It allows teachers to customize learning environments, which is, as many of you may know, the new thing is universal design in learning, making sure that we have multiple ways to get information into you, multiple ways for students to engage with information, and multiple ways to demonstrate what we've learned. And Kurzweil and many of these technology tools lend themselves to that kind of individualization. So, for example, here is this thin toolbar here is the reading toolbar, where students can change the voice that's reading, how fast it's reading, depending on the type of text they're reading. It's a great opportunity to teach students. You need to learn to read different paces for different things. If you're reading a People magazine, you would read it one way. If you're reading your history textbook, you read it at a very different pace in a very different way. So there's all these adaptable tools, but I'm going to just demonstrate this, hoping it all works well. This is an article that I'm going to click on here, Deconstructing Dyslexia, that I assign my students at Landmark College. As we heard earlier from Dr. Shaywitz, I can't underscore the importance of having students name their own learning style. If they're dyslexic, many of my students who are 18, 19 when they come to my class, they're in my class, my particular class, because I know they're very dyslexic. Their testing showed us that they're reading at a 5th grade level or lower. And when I asked them on day 1, what's your LD or what's your diagnosis, I'm always astonished. Many of them don't know. And I'll say, well, I know that you are dyslexic. And by that, I use it very generally to mean you have a hard time processing written language and sometimes spoken language. So part of my curriculum is to really teach them about dyslexia, about learning disabilities in general. And this is an article I'll have them read. And I'll ask them, after talking a bit about pulling out main ideas, to actively read this. So as you'll see, I have it open here. I'm just going to have it read the first paragraph. Oh, one moment. Oh, you know what? I put my mute on because I didn't want to disturb anyone. But now I want to disturb people. Okay. I want to keep
English
you...
is notoriously illogical. For example, if tongue is pronounced chung, why isn't argue pronounced arg? And if enough is enough, why isn't buff pronounced buff? The arbitrary rules that govern English bedevil non-native students of the language as much as they torment would-be spelling bee chums. But such frustration...
Okay, so you get a sense of how it reads. I have this voice named Julie. I like Julie. My students get a kick out of Grandpa. We'll have a listen to Grandpa.
Frustrations pale before those endured by dyslexics who live with...
I'm not a big fan of Grandpa. But anyway, you get the idea that what it's doing is that bimodal input for reading. We're seeing it, we're hearing it, and we're reading it. So there's a lot going on, and you are immediately more engaged with the text. My assignment is to read this article and then pull out main ideas. So again, what's wonderful about Kurzweil is I'll have them just... I'm clicking on the yellow toolbar, the yellow highlighter, excuse me, and I'll say, well, I know this is important. Scientists have learned a great deal, and I promise I didn't do this on purpose, but our very well-known Shaywitz are mentioned in this article, quoted in the article. I didn't even know it until I realized we were both going to be on this panel. But anyway, so you'll get the idea. Say I'm pulling out important parts. Then, what's really interesting, before I extract those, one of the challenges that dyslexic students or any of us have is stumbling upon a word that we're not sure of. Another great feature of Kurzweil is this dictionary. So I clicked on arbitrary, so I've seen that word.
Determined by chance, whim, or impulse, and not by necessity, reason.
So immediately at my fingertips, I have not only the definition, but I can hear the definition. But that's still that's grandma. Okay, let's go back to Julie. Julie, where are you? There you are. So that's another great tool we have there. Now, what I would say to students is, after they've read it, and they've actively read it, they need to write a summary of the article. They can, using Kurzweil, extract what they've highlighted into 2-column notes. So I could say, I used the yellow highlighter, and I didn't use any other color, but basically, it immediately will then create this document, which I can save as a Word document, and it has the details that I've highlighted from that article, which can then help students to go back and review it for a test or for learning or to help them in a summary. I like to leave the left margin blank because I ask students to paraphrase that or put the main idea in themselves. Again, encouraging them to engage with the text. So that's Kurzweil. I'm going to show you some more about that in a little bit because it's also a great writing tool. Okay, here's another thing I want to show you called Readability. It's not a reading software, but it, according to its website, it creates a more comfortable reading environment. And I think we all look forward to a more comfortable reading environment. So as you can see right here, I'm just going to go to BBC. That's a website I like and I send students to. So if you're in 5th grade and you're doing current events or you want students to read something online, this is what you see. So readability, again, is to create a more comfortable reading environment. Well, for those of us who are dyslexic or have attention difficulties, there's a lot going on a written page. Language overload, stimulating. Because I have already downloaded Readability, I have the button right here, and I'm just going to click it, and it's going to convert this article into this, which is a more comfortable reading environment. It just cleans it up. It's just text. It's nice for me as a teacher. I can cut and paste it or copy it more easily without formatting. Students can then read it. They can use reading software if they need to with this interface. And again, back to how amazing that technology is in individualizing learning environments. There's also, in this Readability, this button here can help me individualize. So say I really prefer to read with a black background. Well, it changes that. Or the column width. Because of my visual tracking is really difficult, I want the column to be really narrow, like a newspaper. So all these great features are right there on the toolbar once it's added to your browser. That's Readability. I can also do other things. I can save it, read later, send it to my Kindle, and interesting things like that. Back to the program. Study tools, okay. We want students to learn and remember new information. And typically we, especially as you go higher in the grades, they have to really be able to listen and capture that information that they've heard a teacher say. In higher ed especially, a lot of people still do the old sage on the stage. You got to listen and take notes. And note-taking, as some of you may be doing, and I was trying to do earlier, is kind of the quintessential multitasking activity. You have to attend. For those of you who aren't attending, that's okay. I know everyone's getting hungry. Attend, you have to listen, you have to process the information, you have to prioritize the information, and then you have to encode it or write it out, and then you have to be simultaneously listening to the next idea. And I know for myself when I was in school, I was very bad at that. And many, many students with learning difficulties are, as well as any of us. So this is a handy-dandy new tool, a Smart Pen. My students love this tool. I think Erica might be here, one of former Landmark students. She uses a Smart Pen, I know. And now you do too, Paula, that's fantastic. So basically a Smart Pen is what it says here. It is a pen, it writes on paper like anything else, but it also is an audio recorder. So it's capturing audio of everything that's happening in whenever you have it on. It also allows you to save information and, and search it. And I'm going to demonstrate, so it's on. It does come with special paper. This is the magic paper it comes with. The paper itself has sort of command controls built into the bottom. So I've been listening to you all earlier. Let's see.
This will help very, very much in curing symptoms.
Okay. So when I was taking notes when you were talking, I didn't catch what you said when you were talking about diet. And while I was writing, it's also recording whatever's being said. So this is an amazing tool for students who have a really hard time writing. Oh, I know, I'm getting the wows. That's good.
This will help very, very much
okay.
in curing these symptoms.
So imagine, you're in Spanish class and you've missed the homework, or you want to hear in math class the equation of a slope. It's all in there. It's in the pen. It's both a camera. Actually, what I learned last night, there's a camera on the end of this, and it's actually reading on dot paper the symbols. But let me show you what the search feature is about this. And again, this is not free. This is, though, the bare bones version I have is $99. Let me see. Yeah, so I uploaded while I was listening to this, and I remember when you showed the video of sky. I'm going to search my notes. Well, let's just do all my notes. I'm going to search my notes for sky, and I wrote the word sky somewhere. It's in yellow, right? Oh, there it is. Thank you. It's supposed to be highlighted, but I can't see it.
This picture was me in first grade at Riverdale. Yeah.
So by searching my notes, I can go back to what I missed in class. And if I have a hard time spelling, I can just write IMP for important and go back to that and hear it again. And it makes what used to be, you know, students would have the accommodation that they could have recorded notes or lectures recorded or things like that. It's really brought it to a much more dynamic level. And that is called the Smart Pen. Oops, let's get out of this here. Okay. Another study tool that I love is an electronic flashcard maker, and it's called Quizlet. And there are many flashcard makers or programs out there. Quizlet I happen to like a lot. It's just one that my students like, and it has a lot of great features, again, that allow students to customize the learning environment and engage with information in more than one way. Here's what it looks like. This is kind of a cool thing when you come to the website. It claims this is a live world map of people who are currently creating online flashcards on various topics. And you have access to any of those flashcards that are being made. So someone's doing Arabic over there in Africa, but I'm going to log in to mine. Again, this is the free version. I think there's a small fee you can pay to have a more robust version of this, but I've only downloaded the free version, I've only logged in for the free version. And you come to this place called the dashboard. That's your home page, and it'll say, here's what you've recently studied. Here are sets created by you. And again, back to my classroom, one of the things I teach my LD students at Landmark is all about words and language and break it down for them. And we study word parts so that we demystify language somewhat. And we work a lot on morphology, which is word roots. So here's, for example, on a basic use, it is a flashcard. So I can, right now it has both the term and the definition on both sides, but I can change that. So Jeanne, as in genetic, generic, gender means birth, race. Go to the next card and you get the idea. You can customize this. I ask students to create their own sets for studying for exams and things like that. But often, if they've missed class, I can also quickly email them this set. And here's what I really do love about it are these features down here. So we know that flashcards is really good for rote memory and studying things for test prep. But you can also do these things, these activities to help you rehearse or learn the information. This is a feature called Scatter Game, and I have to now drag cron. Okay, I know that means time. And ology. And so again, for kids who really are more interested in the movement and the flexible formats of technology, this is just a great tool for getting them to engage with the information that you're trying to teach. Let me go back to dashboard. Another great feature I like about Quizlet is that you can go to find sets, and these are the existing thousands and thousands of flashcard sets that are already out there. And a while ago, I was teaching LD support at a high school, and I know students like ninth graders typically are studying 8th, 9th grade angles, and I see that there are a lot of sets already in here for angles, and these have images, which is great. So I didn't create these, but they're in there, and it's just, again, a great way with a visual included to review and rehearse information and to learn. And then again, there's different games you can play. This one's Speller. If you have a hard time reading, I can have it say, replay.
Square.
Square. Okay, I think I know what a square is, but I'm not gonna then you put the definition in there, and if you get it right,
Square.
it will rehearse and say you didn't. But anyway, so that is a free website that I love. It's called Quizlet. There are others on your resource sheet. One's called Study Blue,
Square.
I also like. And let me just get back to, I know we're running short with time. Writing tools. Okay, I talked about Kurzweil as a fantastic reading tool, but it's also a great writing tool. We know LD students are struggling writers. They have a hard time organizing their ideas, spelling words, generating ideas, and Kurzweil is a great way to tap into helping them do all those things. Here is, and I won't show you, I just have a screenshot of this, but you open just Kurzweil, you select New, Brainstorm, and Blank, and we know that many students really like to generate ideas using a flow chart or a concept map. So Kurzweil has something a lot like inspiration. We use that at Landmark a lot too. So students can generate and move things around in a visual manner, and then you can click on split screen is one of these buttons. I can't see, but it's called split screen, and it converts that flow chart into a linear outline. And then students can start writing right over here while looking at their outline, which is a great assistance for students who are always losing papers. And what was I going to say? Another great writing feature is this little, what's that called? A magic ball or crystal ball? Crystal ball. There's a little crystal ball icon right here, and that's word prediction. So as students are writing, and dyslexic students know, I think we heard about mistakes you can say with assessments and other kinds of words. Students can be putting an ASS, and it will bring up a whole bunch of words, and then they can hear which words. Because again, you ask a dyslexic student, say, is it assessments or assessing? Visually, it's very difficult to know the difference between assessing, but they'll hear those words and just click on it and insert it into their document. Kurzweil is also phenomenal. I don't know how many of you as teachers or parents have read students' papers to them so they can hear what they've got wrong. I didn't mean that, I misspelled that. Well, Kurzweil is essentially doing that with them, so they're more independent in proofing their own papers. So, I'm sorry, you'll see here, this word is meant to be especially, but it will be pronounced especially, and they'll say, hey, that's not right, and they'll go back to be able to proof it. Okay, I'm almost finished here. This is another software program we really like at Landmark, or I like it using it with my students. It's called Ginger. It's free. It's also an extension that you just upload, and it's sort of always working in the background. And what's neat about this is it's not, while Word and all other programs have great spelling and grammar checks, this one is context-based. So, for example, one sec. Let me just open up a sheet. I'll open up this document, and I took this sentence from a student's paper, and here's what they wrote. The purpose of this paper is to provide a summary of cultural anthropologists' work in Lima, Peru. Okay, that's classic. It's a great sentence. It's a very good idea, but it's got a lot of misspelling. So if I just say ginger it, it's up there. Ginger will say, here's what you wrote, but did you mean to say this? The purpose of this paper is to provide a summary of cultural anthropologists. So it doesn't just it doesn't just say this word is misspelled, but it says, didn't you mean this? And again, for a dyslexic student, it's like, oh, that is what I meant to say. And it's almost perfect. We don't want summer, we want summary, but it's much better than what it was at first. Many of my dyslexic students, it's so hard for them to figure out which word they want to spell when they all look alike. So this is a great tool. Similarly, with this little sentence down here, I'm sorry, let me go to, I'll skip that, and I'll go to the next one. So I wrote, the book is in the table, but again, nothing's misspelled there. But Ginger has said, I think you want to say the book is on the table. And those are a lot of common mistakes that LD students will make, all of us make, let's face it. So it's a great tool for me. I use it before I send out those big broadcast emails. Okay, I think I'm getting close to wrapping up here. Okay, last thing I want to show you. Many may have heard of Dragon Dictate, where it's voice dictation. Students literally speak into the microphone and generate the text. But as we heard earlier, we are all with our smartphones and iPads and things like that. I saw my students do this, and that's why I was like, now that's brilliant. And they're like, yeah, it's free. So I downloaded Dragon app, and what they do is, it's very simple. They'll say, chromosome, because they don't know how to spell chromosome. I know how to spell it, and there it is, chromosome. So if they're stuck on a word, I mean, these are just creative. LD students are so creative and resourceful. This is just a handy little tool for them to be able to access words that they may not have known how to begin. Is that a K, chromosome? So with that, I want to just finish with some tips that we've learned at Landmark. I've learned that these things aren't intuitive. Students tend to resist using new tools, so you need to explicitly, and we're lucky that I can say it's part of your grade, you have to try it. Make it explicit instruction. It requires a great deal of practice before it becomes the way that you learn. Students do need to experiment with many things. Many of these will work with some, they may not. But what we say at Landmark is you have to learn the chords, or I say it, you have to learn the chords before you can improvise, which means you got to try all these things, and then you can figure out what works for you. We ideally want students to be independent, successful learners, and they need to see what's out there before they can determine what's best for them. And lastly, it can be frustrating for students to learn these new technology tools. It is technology. I spilled my water on my smart pen, but it still worked. There needs to be supports available for students and school systems to be able to integrate these technology tools. And that is all I have for today. Thank you very much.
Liza, that was terrific. I now can use my live scribe to do Quizlet and to add a little ginger and a little bit of Kurzweil too. I'll be good. Anyway, that was I know how successful that talk was when I looked around and everybody was either writing, talking to somebody, very excited about some of the things that were shared with you today. And I'm sure there's so much more out there that many of us don't even know about. We're now giving awards to those of us who exemplify Churchill's mandate. They are the true barometer of what we should all do for those with different needs. That is Dr. Harold Koplewicz, Dr. Christine Sia, and Nanci Bell. And I'm so honored to not just talk about them as honorees, but to call them my friends. I'm lucky. Chancellor Merryl Tisch is here to give an award to Dr. Christine Sia. They are both from the Board of Regents, and I think everybody knows them or will know of them after today. So, Chancellor Tisch.
Thank you very much. One of the great parts about being at a colloquium on a subject is you get to sit in the room and know that they've actually identified all the right people to honor. Because the truth is, as you look through this book, I could speak personally about each and every one of your distinguished honorees, from Harold to Linda to your guest speakers, the Shaywitzes, and of course to the woman, and of course to Dr. David Steiner, whose building we are sitting in today, who served as Commissioner of Education, and modestly, I'm sure he won't tell you this, single-handedly received the greatest grant ever given to a public education system in the country, and that was the $700 million that Dr. Steiner won as the head of New York's Race to the Top effort, and to him we owe an enormous debt, Dr. Steiner. Today I am here to present an award to a friend, and I always like to start with friend because I think that is probably the most important way you could describe someone personally and truly a friend. And secondly, as a colleague. And thirdly, someone who I admire so much for the work that she does. You could read Dr. Sia's bio in the pamphlet. So I'm not going to bother you with the reading of the bio, but what I'd like to do is tell you about the role that Christine Sia plays on the Board of Regents. First of all, until Christine came to the board, it was a 16-member board, and someone brilliantly decided that Staten Island, which is a very important borough, should have its own representative. And it was one of those seats on the Board of Regents where everyone just coalesced around the right person to put on the board, Christine Sia. First of all, her documentation for qualifications is just extraordinary. But beyond that, she brings a component of in-depth understanding of students with special needs. And more than anything, she understands that serving students with special needs as they come into our school system, as they transition out of our school system, as we hope to create for them a mechanism by which to lead independent and productive lives, is the exception, not the rule. This is a tragedy in the greatest democracy that I think civilization has ever known, to be standing in the year 2013 and to describe this list of competencies as an exception rather than the rule. Christine leads this work from deep understanding. She leads it from deep knowledge, but she leads it most importantly from personal conviction. Ladies and gentlemen, it is a pure honor and pleasure to introduce you to Dr. Christine Sia. Christine, it's very nice. It's really nice. It's really, really nice. Do you know how great she is, everyone?
I think if I didn't say anything at this moment, I wouldn't have to. I would only detract from Merrill's wonderful introduction, but I'm going to speak. Thank you, Merryl, Paula, and Adam. Thank you so much for arranging this very prestigious event. David Steiner, thank you for hosting. And to my fellow honorees who do wonderful work in the field, thank you. Thank you. As Merrill suggested, I come to the field not as a teacher, not as a school leader, but I received my education in special education through the personal experience of raising a daughter born with intellectual disability. An experience that has and continues to be the impetus for my life. And you could read my bio also to let you know where I've gone from there. In fact, had it not been for this experience, my life might have taken a different course, and perhaps I would not be at this podium today accepting this very prestigious award. My daughter was born in 1971, and as we all know, things have changed considerably in special education for children with disabilities since then. Two pivotal events that occurred during this period stand out in my mind as the start of these changes. First, deinstitutionalization moved children away from segregated environments to full living in the community. Although my daughter lived at home, this movement helped shape the future of her life as well. Second was the passage of PL 44-142, PL 94-142, Education to All Handicapped Children's Act, that I'm sure we all know about, that called for public education for all children, including children with disabilities, and my daughter was one of the first groups to go into school under this new law. That's another presentation. But undergirding these significant events was parent advocacy. And I don't know how many parents are here today, but I just want to talk for a minute about that. For any parent that's here, it is important to realize the significant impact of your advocacy as a force of social change. This advocacy has closed institutions, built schools, developed educational programs and services, and spearheaded the efforts of legal advocates, leading ultimately to the policies that we have today. There is not sufficient time to go into all the inroads that we have been making in special education over the years. We all know what they are. But taken together, these inroads have helped students progress to levels we did not know were possible in 1971. For example, today, one of the most important topics in special education is transition. Transition from school to work or to post-secondary education. And we at the Regents want to ensure that students with disabilities are career and college ready when they leave school. Two of the items that are under discussion at present at the Regents are how do we provide for students with disabilities with a meaningful career and technical education to prepare them for employment? How do we develop meaningful replacement for the IEP diploma that will let potential employers and post-secondary schools understand about the specific skills and types of learning that students have achieved? As a final note, I just want to say that Regent Betty, Rosa, and I have the privilege of co-chairing the Adult Career and Continuing Education Services Committee, that's ACCESS for short, on the Regents, that address the needs of students with disabilities in transition. I know that I speak for both of us when I say that one of our goals is to work with the department to ensure the coordination among families, students, and school districts to ensure successful transition as students leave special education and take their lives into the adult world. I thank you again for this wonderful honor. Thank you.
Would Dr. Harold Koplewicz be prepared to accept his award from Dr. Sally Shaywitz?
Merrill, I wish I could speak off the cuff like you have, but I can't, so I will read my comments. Come close. It's a great pleasure to introduce this year's honoree in psychiatry and children's mental health, Dr. Harold Koplewicz. It's a particular pleasure for me because not only have I been honored to call Dr. Koplewicz a friend for a number of years, but we're both graduates of the Albert Einstein College of Medicine. Many of you know Harold is the founder and president of the Child Mind Institute. In fact, Dr. Koplewicz is one of the nation's leading child and adolescent psychiatrists, is widely recognized as an innovator in the field, a strong, and I mean strong, advocate for child mental health, and a master clinician. A born leader and entrepreneur, prior to creating the Child Mind Institute, Dr. Koplewicz founded the NYU Child Study Center in 1997 and served as its director for 12 years. He has many accomplishments. He was the first Arnold and Debbie Simon Professor of Child and Adolescent Psychiatry. Under his leadership, the NYU Child Study Center made tremendous contributions in the field through expert clinical care, a robust research portfolio, and advocacy for child mental health. In addition to founding the NYU Child Study Center, Dr. Koplewicz serves as the director of the Nathan X. Klein Institute for Psychiatric Research, the first child and adolescent psychiatrist to hold that position since the institution's founding. Here, he expanded the research portfolio to include child and adolescent research. Could you believe one person could do all these things so well? And so young. Now you said the best. Established the Emotional Brain Institute, recruited new investigators, improved transparency and efficiency, and launched a capital program to enhance the Institute's ability to garner federal funding. And he has many honors. I can only mention a few. He's been repeatedly recognized in America's Top Doctors, Best Doctors in America, and of course, New York Magazine's Best Doctors in New York. He has been honored by the American Psychiatric Association, the American Society for Adolescent Psychiatry, and the American Academy of Child and Adolescent Psychiatry. Since 1997, he has been editor-in-chief of a very important journal, the Journal of Child and Adolescent Psychopharmacology. He is the author of several acclaimed books, including It's Nobody's Fault, New Hope and Help for Difficult Children and Their Parents, and More Than Moody, Recognizing and Treating Adolescent Depression. It's my honor to present Dr. Harold Koplewicz with the Distinguished Leader in Special Education Award 2013.
I want to thank Sally, but I also want to thank Paula. She's an amazing resource we have here in New York, and I'm so glad we get to share her today with all of you. So thank you, Paula. I also want to thank my fellow honorees. I am honored to share this with you, but I have to tell you, it's about their generosity. So I have to tell you that starting with Cece, she's so generous that I remember as a pediatric intern being stuck on a case at Jacobi Hospital where I was really worried about something I had done. In those days, you gave antibiotics to kids before you had the culture, because the cultures took so long. And one of the antibiotics we gave was called kanamycin, which can cause deafness in a child. And it was a very young child, and we were worried about a total infection that would kill the child, so we went ahead. And a month later, the child reappeared in the hospital with another fever, and the child didn't look like she could hear. And I was devastated because I was the doctor who had written the prescription, and in comes famous doctor. She had a different name, Dr. Cece Daum, and she walked in and she examined this child, and with a gentle quality and a generosity of recognizing how shook this intern was, proved very quickly that the child could hear, but also picked up that the child was terribly neglected after very gently interviewing the mother. That kind of generosity is among all the honorees and all the presenters, because many years later, when I became a father, our middle son, who was at the same school where Merryl's kids were. In fact, Merryl was one of those mothers, by the way. My oldest son was in the same class with her oldest son, was one of those generous mothers who also told you not to worry and also always had the answer. So I'm so glad she's no longer a mother at my kid's school, but she's now the Chancellor of the Board of Regents. So she can tell us a lot of answers now that we need. But we had a child who just couldn't read. And it was really a problem because he was great at math and he wasn't really very good at reading, and we were getting him lots of help, and he was in 3rd grade, and unfortunately they turned math into reading. And so he punched someone in the head and came home and said to us, "I'm really upset because I was 2 steps ahead of everyone in math while I was 2 steps behind everyone in reading, and yet they've turned math into reading." And we were stumped. I have to tell you, we were getting all this terrific help and nothing good was happening, and someone told us about Lindamood-Bell, and we thought we were going to have to move to San Luis Obispo, and we were very lucky they had a branch in Belmont. But again, the generosity was not only did this child do very well, but then we needed to continue this treatment, and we convinced Nanci to literally live in the Hotel Wales for a while she continued while Adam kept going to Dalton in the morning. And I can proudly tell you that while Adam still reads very slowly and writes very slowly, he still graduated from Columbia Prep, and he went to Dalton, he went to Goldman Sachs, and he still makes a living. So, and he's very, very grateful to Nanci Bell. But the generosity continues in this personal story that later on he became fascinated with dyslexia and desperately wanted to do research on it, and reached out to Sally Shaywitz, who I did not know, And Sally invited him up during his spring break, and he spent days there with the Shaywitzes, finally doing neuroimaging with Bennett and looking at dyslexic readers compared to non-impaired readers. So we're very fortunate, and I see David Steiner here. There's so many people who care not only about their own kids, but they care about somebody else's kids. So today, I want to spend a moment, though, talking about the fact that while this group is like preaching to the choir, the real problem that we have, as far as I'm concerned, is that the world still doesn't understand what's going on with our children and the kids that we care about. The events in Newtown, Connecticut, while fortunately rare, very, very rare, even though it doesn't seem that way, statistically rare, is a tragedy that needs to hopefully be the tipping point. And the fact that President Obama and Vice President Biden have gathered 15 of us who are in the mental health and disabilities field, the one thing we all agreed upon was that there's a need for a national conversation about how real, how common, and how treatable these disorders, whether it's dyslexia, autism, ADHD, or all the others that 15 million children suffer from in the United States, where less than half get any help. And that while all of us will agree that no American needs to have an assault weapon, that is not the answer. That's not the only answer to this problem. We need to think about diseases above the neck with the same kind of scientific rigor, the same kind of compassion, the same kind of attention as the rest of the body. And this is the moment. I mean, clearly, this conversation has to start. May is Mental Health Month. I was trying to explain to the Vice President that it really should be Speak Up for Kids Month, because 75% of all serious psychiatric illness occurs before the age of 24 and 50% before the age of 14. So the fact is that you're much more likely to hurt yourself than hurt somebody else if you have one of these disorders. It is nothing less than outrageous that in the middle of all this shootings, someone says, oh, he must have had Asperger's, which makes so many people frightened. And it's because the evidence is that people who have Asperger's might get angry, might get aggressive, but not in a premeditated way to go kill 20 people. It's hopelessness and helplessness that makes people strike out against themselves and against others. You know, there's an interesting fact. Attorney General Holder was sitting at this meeting, and some woman spoke from the Federation of Families and said, I've gotten so many calls from family members, parents who have a child who's sick, who are now worried that their child will be ostracized or be asked to leave a school. And she said, and I turned to the Child Mind Institute to write something about this on our website, and I said to Holder, 5,000 people between the ages of 14 and 24 will kill themselves this year. Suicide rate hasn't changed since 1960, 5,000. But 600,000 will show up in an emergency room because of a serious attempt. You can be Republican, you can be Democrat, it's unacceptable. You can be conservative and liberal. That statistic is unacceptable for, as Merryl said, the greatest nation in the world. So this is our moment. It means that after we leave this, it's time to write to your congressperson, it's time to talk to your state senator, it's time to talk to your friends. Our children deserve the same rights as kids who have diabetes, who have cancer, and this nation can do it. I'm old enough to remember when we whispered the word cancer. There are people in the room who are old enough to know that FDR tackled polio in a way with the March of Dimes, and I certainly remember the fear we all had from AIDS, and when President Clinton embraced it, and when Rock Hudson said he had it, and Doris Day hugged him. Today, we have a whole new set of medications, and people with those diseases don't frighten us as much because they get to live normal lives, and they die of something else. And we're not frightened in schools. Do you remember in schools we had to wear gloves and boots, and somehow Ryan White changed that, and more importantly, we started teaching kids about safe sex. We can certainly do this for psychiatric disorders. So I thank you for this honor, but I have to tell you, I need your help because we have so much more work to do, and we have to do it right now. Thank you.
Thank you, Dr. Koplewicz. Incidentally, in the issue of Education Update, which you all should have received today, there is a guest editorial there by Dr. Koplewicz, and I'm sure that you would find it compelling reading. And incidentally, Dr. Koplewicz, I remember way back when CRMD, which was for mentally retarded children, were classes that were in the basement. Gary Hecht, superintendent of District 75, is here. They were held in the basement of the school. That's where you would find them, no place else. So we're now delighted to announce that Nanci Bell, who is the co-founder of Lindamood-Bell, with branches all over the country and indeed all over the world now, will be given the next award. And the presenter is Dr. John Russell, who is the head of the Windward School. And the Windward School is now coming to Manhattan in a whole new location. They're expanding. So again, we're delighted. And Nanci, would you come up as well?
Well, I'm delighted to be here, and this has been a tremendous learning experience for me. And one of the key takeaways that I have gotten today is never speak after Harold Koplewicz. I just want everybody, I think the presenters before me are obviously very, very well known, and I presume that most of you don't have a clue who I am. So I want to tell you just a little bit about me because I think it gives more meaning to having me present the award to Nanci. So in terms of confessionals, I am a recovering public school superintendent. And I've been recovering for the last 7 years, where I had the good fortune to be the head of school at the Windward School. The Windward School has 557 children with language-based learning disabilities, and 1/4 of our children come to us new each year and 1/4 leave. And the reason I say that is we have a tremendous demand in the New York metropolitan area for services for children with language-based learning disabilities. Our colleagues, Louisa Motes and Reed Lyon, in their work, have documented over and over again how well-intentioned, hard-working, dedicated teachers are ill-equipped to really deliver the kinds of research-based programs that are so necessary for the remediation of language-based learning disabilities. These are not people who don't care. These are not people who aren't working hard. These are not people who aren't supported. They're just people without the research-based programs that they need so desperately. In fact, if you look at New York City, there are 1.1 million students in New York City, and based on Sally's works and Bennett's works, we could safely say 20% of them. If you look at the IDA figures, you might say 10%. 100,000 to 200,000 children with learning disabilities in New York City. There are 1,200 seats in specialized schools for kids with learning disabilities. I can't tell you how many times parents have come to Windward where we've had, unfortunately, to tell them, we don't have any seats available. We don't have any seats available. And I would have said, until I became head of Windward School, as a superintendent, I never would have recommended a private organization. And when I became head of Windward School, I became much better informed about the great work that Lindamood-Bell does for our children. And Nanci Bell has been part of the core of the program. It was her work on visualization that moved Lindamood-Bell to the prominence that it has now. So normally, as a superintendent, I would be extraordinarily reticent to recommend or commend a particular program. It's awfully liberating being a head of school, though, because there's an I in independent that you can really relish. So I am delighted and honored to be able to say that Lindamood-Bell, and Nanci Bell in particular, her work that she's done, and you can look, again, I'll refer to the bios, you can see all of the work that she's done in literacy, in research-based program, that are the basis for the Lindamood-Bell program that have helped so many of our kids who are struggling to do well and to achieve their full potential. It is their program that has helped so many. So I'm delighted to present the award to Nanci Bell.
Thank you, Paula, for this tremendous and distinguished honor. I'm very pleased to be here. I begged her. I sent her an email, Harold, and said, please don't let me follow Harold. And so, yes, John, you're right. I'm going to be brief. I'm going to read you a couple of stories. And while I'm doing that, I want you to turn on your imagery, because Pat Lindamood and I and hundreds of Lindamood-Bell instructors over many years now have had the honor to work with literally thousands of children and adults who have struggled to learn to read and comprehend. As we worked with those students, we looked eye to eye and heart to heart and tried to understand what it was we could do that they couldn't do. And we first identified the primary problem as phoneme awareness, and then realized that reading is made of component parts, and phoneme awareness was going to help when we developed that, which we always could, was going to help those children and adults sound out words, but it might not help them be able to read fluently on the page. And that was because too often we couldn't teach them to memorize words that would help them read contextually. And so as we kept asking ourselves what it is that they can't do and we can do, we realized that the work of Dr. Alan Pavio in the field of cognition, he believes that dual coding is the basis of all cognition, and of course reading and writing and speaking and thinking, all of that is cognition. He believes that, and we concur, that the link between imagery and language is one of the primary sensory cognitive functions a student needs in order to read and comprehend. We've worked with students that have been labeled dyslexic and labeled hyperlexic. How many of you know what hyperlexia is? That is the saddest thing. For 20 years I've been up talking about hyperlexia, and still most people know about dyslexia but not hyperlexia. And I think hyperlexia might be a worse challenge to overcome, and that is that you can read fluently, but the words go in one ear and out the other. And it doesn't matter whether it's written language or oral language, that language goes by you and you have difficulty comprehending and thinking. Now we are conducting research with MIT and UAB, University of Alabama. In that study, we're looking at autism and the relationship between autism and imagery. And we're looking at MIT, the relationship between imagery and dyslexics. So we continue to march along. Pat's gone now, and what she used to say to me was, we'll keep on keeping on, Nanci. And so here we are. We believe passionately that every child and every adult can learn to read and think. And we believe that those individuals that struggle with learning challenges experience a primary weakness in the ability to create imagery for words and concepts. And I'm going to read you a story to bring this home for you. I just received it days before coming here. And this is a young girl in New York City that came to our learning center, and her teacher organized for her to be able to receive a scholarship to come to our center. And this is what her teacher said. Thank you so much for participating in changing the life of Beatrice. She has completed all 240 hours of reading intervention at Lindamood-Bell in New York City. She now can not only sound out new words, understand what she is reading, and self-correct her writing, but her self-confidence has also soared. She is now certain she can achieve the academic success she had hoped for in college and beyond. Beatrice wrote the following about her experience as a reader when she was prompted to write about a life struggle. And this is why I decided to read this to all of you. This is someone else's child, Harold. Quote, I knew that at a young age I needed help with reading, but not a lot of teachers helped me or pushed me. It was hard to do homework, and it was hard to read in class. As I got older, my mom tried to help me a lot and find something or someone to help me to get better at reading. I would get mad because when I didn't understand things on a test or in class, I just wanted to give up. My mom kept pushing me to keep doing my best, and also pushed myself. I knew I could do it, I just had to keep on trying. My grades were not so bad in middle school. I worked hard and studied harder than other kids. When I got to high school, things were harder, especially in 10th grade. I had teachers who could tell that I was trying my best and that I was working my butt off. My teachers helped me to get into a program that really helped me read and write better. So today, I, Beatrice, can read in class. I'm still pushing myself to do more because I know I can give my best in all that I do. And then this is what, and that's unquote, this is what her teacher said. This year, Beatrice is in my 11th grade literature class, and it is truly amazing to see how far she has come. Not only does she have a better understanding of the content of the course, but it's also very clear that she now has the tools, and we would say the sensory cognitive tools, that first domino, to understand and overcome her learning disability. Thank you so much for changing the life of a smart teenage girl. She improved her reading by 5 grade levels. Thank you for believing in my student and fighting against the often insufficient resources dyslexic students are confronted with in public education. Thank you for believing that high school students who struggle to read still deserve a chance. My colleagues and I are extremely grateful for your continued support. Her life was changed because we all kept on keeping on to do our best. And so now I'm going to read you the last story, and I'm going to ask you once again to turn your imagery on. So start your engines. Many years ago, there was a little girl named Nanci that lived in a big ranch on a big cattle ranch, in a big house on a big cattle ranch. Her friends were her cats and her horses, where she spent many hours alone talking to them and, as you might think, teaching them. Never in that little girl's wildest dreams, staring at those mountains, hearing the wind in the pines, sitting on a fence, are you imaging? Sitting on a fence with her horse friends surrounding her, did she think she would have to sweat at night over an acceptance speech for an award in New York City. I am honored to accept this award and grateful to be doing this with my life. Thank you.
I have something very, very exciting. And by the way, Nanci and your hubby are here from warm California, so that deserves another award. I have a special surprise to share with everyone today, and I'm very excited about this. Education Update has created for the first time an Unsung Heroes Award for somebody who has braved, gotten through difficult times, conquered incredible odds, and continues making a contribution to society. And this year, we've chosen Dr. Christopher Rosa. He's an exemplar. He's our first honoree. He had muscular dystrophy as a child and went on to earn a PhD and to work at CUNY in his current role as University Assistant Dean for Student Affairs. I'd like Christopher to come up here, and Jeanne Alter, who is the Executive Director of the Kennedy Child Study Center, will present Christopher his award. And not only will he get an award, but we're creating, just like the Vietnam Veterans Wall in Washington, D.C., we're creating a wall on the Education Update website. Each one of these unsung heroes will have a brick on the wall, and when you click on the brick, you will discover the biography and the story of conquering the odds. And my hat is off. Christopher, you are fabulous, and we all salute you. And
so after that complete morning and all these speakers, I have the privileged to announce this new award, and also right before lunch when everyone is ready to go. So I will absolutely be brief in my remarks. As an early educator, my professional life is truly dedicated to the success that children have, because when they're young with special needs and we can get them to get to kindergarten and to be able to take advantage of all the resources out there, we know we've been successful. So I would just very quickly just say that one of the things that Dr. Shaywitz said that caught me was about education as a civil rights issue of today. And disability should really be secondary to good education, replete with teachers who believe and understand how to define success for each and every student. When students are successful, we know that good education has happened. And so I'm proud to present this award to Dr. Chris Rosa, whose success in society is secondary to any definition of his physical abilities, because this Unsung Hero Award speaks to who he is as a person, and that's, to us, what's important. Chris is a Phi Beta Kappa graduate of Queens College, earned a doctorate in sociology at the CUNY Graduate Center. His dissertation was titled Disability Rights, the Construction of a Disability Culture. At age 9, Chris was diagnosed with Becker muscular dystrophy, a progressive neuromuscular disease. He's a member of the New York State Independent Living Council, where he's involved in ensuring that state agencies provide services to consumers with disabilities in ways that empower them and foster their independence. In addition, Chris has served as the chairman of the Subcommittee on Employee Disability Concerns of the President's Committee on Employment of People with Disabilities. He was named a Muscular Dystrophy Association National Vice President and is also a member of its board of directors. Chris can now place the first Education Update Unsung Heroes Award next to the Muscular Dystrophy's National Personal Achievement Award, which he received in 1997. Education Update is proud to salute Chris Rosa for his spirit and his efforts on behalf of individuals with disabilities. Please join me in extending congratulations to Chris for this award.
Present it to Christopher. He'll take a photograph of you.
Thank you. Thanks, Jeanne. Thank you so much. Thank you very much, Jeanne, for that beautiful introduction, and to Paula and to all of you for this remarkable honor. It's very humbling to be recognized as an unsung hero. Quite frankly, I'm not sure if I'm worthy of the title or the honor. I've spent much of my personal and professional life working closely with other individuals with disabilities to demystify what disability means in contemporary American life. And so heroism doesn't quite sit so easily with me. Quite frankly, the unsung part, I've been fortunate enough to build a career at the City University of New York and to have as my friend and my mentor, our Senior Vice Chancellor for University Relations, Jay Hershenson, who's a real giant in American public higher education. And he's recognized something in me. He's been a tremendous supporter, created opportunities for me, and thanks to him, it seems as though I'm sung about as frequently as the Star-Spangled Banner. So this is he was the one who introduced me to Paula, and we've created a wonderful relationship. And so I'm grateful for that friendship with Jay, and also the one that he cultivated between me and Paula. So I thank him for that. Although I'm not so comfortable with the notion of an unsung hero, I think about who has been a hero for me, people like Jay Hershenson in my life, and individuals like Chancellor Merryl Tisch, who you heard from earlier, who, through my relationship with her, really was able to transform what it meant to be a college student with a disability at CUNY. I was fortunate to meet Chancellor Tisch early on in my career, and she shared a frustration that college students with disabilities at CUNY would get a really terrific and meaningful post-secondary education, but would encounter the same struggles when it came to seeking competitive employment that all other individuals did. They didn't fare much better in the labor market. And so thanks to her wisdom and her insight, she was able to help us to forge a partnership with Access VR in New York State, our state rehabilitation agency here in New York. And together, we were awarded, thanks to the leverage of Chancellor Tisch, a $7.8 million grant to work collaboratively, CUNY and Access VR. And through the program, we created the CUNY Leads program. Now college students with disabilities who go to CUNY graduate at a rate of graduate at a high rate and are employed at a rate of 70% upon graduation within 18 months of graduating. So they've really transformed the experience of college and what it means for students with disabilities. So if being a hero means that I could aspire someday to be a hero like Merryl Tisch, I will accept that humbly as an aspirational goal. I'm particularly honored to be here at Hunter College, one of the cradles of CUNY. I'm a CUNY I'm part of a CUNY family through and through. My brother, sister, and I all have degrees from CUNY, and my mom is a Hunter College alumna, class of 1961. And when I think about what heroes mean, I think about my mom. I'm a first-generation IDEA kid. I entered elementary school in 1971, a year before the IDEA was placed into law. And my mom had no personal experience with disability when I was diagnosed. And she never considered herself an advocate. She was an educator. She learned to be a teacher here at Hunter College. But she understood what good teaching was, and she understood the value of an education. And she was fiercely passionate that I would get one. And just through her sheer will, I was able to have access and opportunity to remarkable educational opportunities. Through her sacrifices, she built the life that I now enjoy. She continues to teach at age 73 to this day. She's still the greatest teacher I've ever encountered. So if being an unsung hero meant that someday I could grow to be a hero like my mom, I humbly accept that as well as an aspirational goal. And finally, at CUNY, I'm privileged to work with the university's more than 500,000 students, many of whom are first-generation low-income students. Every CUNY story is a remarkable story, and the university is just a gift to all of us. It really makes the American dream possible for so many of us here in New York. And I'm particularly humbled to work with the university's more than 9,000 students with disabilities. The New York State Department of Education tells us that there are currently 38,000 students enrolled in post-secondary education in New York State. 9,000 of those students are at CUNY, so your chances are pretty much 1 in 4 that if you're a college student in New York State, you're at one of our 24 campuses. And our students at CUNY have taught me tremendous lessons about resilience, about determination, about strength, and about talent. And if being an unsung hero means that I could be a hero like any one of those 9,000 students with disabilities, then I humbly accept that as an aspirational goal. So I thank you very much for this opportunity to be counted among all of you, wonderful, remarkable educators who are really changing what it means to be a student with a disability in the schools in which you work and the systems in which you serve. Together, I think we're all involved in remaking the face of what it means to be a person with a disability, not only in our schools, but in all aspects of American life. And so thank you. I look forward to learning with you over the course of the day. Thank you.
Chris, you bring tears to my eyes. There is no greater hero than the things that you have conquered and where you are today. Before we break for lunch, I just want to tell you that we're going to have a panel of fabulous students talking about their own experiences. Dylan Redford has come all the way from Vermont to talk to you. Ethan Arberman has come from Boston, and we have Vivian Freitas, who is from New York City. But nevertheless, the local challenge of the snow is something to be commended. So please enjoy lunch, and after the panel, the students will be the parents sharing their experience and their journeys, and maybe they can be of some help to the rest of you. So if you have any questions, please email them. We will take them at EdNews 1. and enjoy your lunch. To be resumed.